right now we have the inpatient care and then the surgical care for surgeries, and then inpatient care. So we have the two modules, which have been great. Coming into the hospital setting, I had worked at the other hospital in the OR, but had never done this case management type stuff in that setting. I'd done it for home health, but we didn't have MCG. So it's been amazing. I've learned so much, and I learn all the time. Get on there, and it's so great to educate the doctors, because I was just telling these girls that the doctors we have worked at the other hospital, and they've been doctors for a long time, and they still had no clue as far as what to admit, how to admit a patient, what guidelines, how long they can stay, the process. And so I've been able to show them with MCG, and a couple of them have sat down with me, and we've gone through different criteria, and just letting them know, this is a guideline, and why, the one neurosurgeon argued with me about one case, a cervical case, and I said, well, why doesn't it meet criteria? And so it was so nice. I didn't have to just argue. I had something to back up what I was saying. And the training that I received was really good too. And just, like I said, it's so user-friendly. I've been able to just get in there, look around, do what I need to do. The evidence-based guidelines that they have, everything is backed up by evidence-based research, and that's so important. And it always evolves and changes, and they've added new things. So I am trying to prepare for when we are able to take Medicare. So I've been looking at a lot of the stuff that's correlated into there from the Medicare guidelines, the inpatient-only coding and stuff like that. A lot of our payers now are going to a DRG pay system. So I've been looking at that portion of MCG, where the correlation from the DRG and how it correlates into the MCG coding or codes. Mm-hmm. So yeah, it's been a nice addition. I'm so glad we had it.
Yeah.
And the company that's the other shareholder so they have 49% is New Health, Nuterra, and they were the ones that said, "Oh, you need this. We're getting you this, putting this in." And I think the doctors were a little hesitant at first to pay, because it's another cost. But I'm so glad that New Health was on board, and they have it at all of their hospitals,
Right.
all their other hospitals. The other hospital we have in Casper, so